Hello, my name is Paul Donnelly. I'm an ST3 radiology doctor in the west of Scotland. Many thanks to the American College of Radiology on behalf of myself and my colleagues for accepting our audit for poster presentation. This was on the impact of reducing lens radiation in CT brain through technician education in a busy Scottish General Teaching Hospital. CT brains are being performed for almost any head injury according to NICE and SIGN guidelines. Modern CT scanners are unable to angle their gantries to go in the field of view sufficiently to exclude the lens, and this can be associated with the development of cataracts and is particularly important in younger patients. The aims of this audit was to identify the proportion of CT brains that included the globe or lens and to evaluate the impact of radiographer technician education and intervention on performance in a second audit cycle. We used 50 consecutive CT brains included in the first audit cycle, and then we had some intervention in the form of education to the radiographers and technicians, and a second audit cycle was performed 8 months later. The standard of this was 100% of lens exclusion. To quickly take you through the results, you can see more details of this in the abstract. The first cycle took place between the 1st and the 5th of November. We had 47 CT heads, and all 47 of those had both lenses included. The age ranged from 22 to 92 with a median age of 66. This is where we had our intervention with the findings of the first audit cycle was shared with the radiographers and technicians, and they were asked to ask the patients to tuck their chins down or use the aid of a wedge if required to remove their lens from the radiation field, and also to record this in the patient's electronic record. Second cycle took place from the 19th to the 21st of July. We had 44 CT heads included in this, and the number of scans with the lens excluded was 3. So between the first and second cycles, we had a small but statistically significant decrease in the number of scans where both lenses were included in the radiation field. In Hermeyer's Hospital, over a course of 5 years, there was just under 30,000 CT heads performed. 20% of our audit patient population was aged 50 or less, and over 40% of these patients had more than one scan in the last 5 years. Obviously, radiation to lens is associated with cataract formation, and with the IRMA guidelines, no lower dose limit is set for lens damage. CT brain is a common examination with a significant proportion of patients receiving multiple examinations, and whilst we had some improvement between audit cycles, there was still a high percentage of lens included in CT brain examinations. We also found that we didn't have any electronic entry for the radiographers and technicians in attempting to get the patients to tuck their chins to get the lens out of the radiation field. We've had further re-education with a medical physicist present, and we plan to re-audit again in the future to see if we can get this number even lower. Many thanks.